there, my name is Shannon, and my presentation is on the physiology of the heart failure. The drug I chose is enalapril, and its common names are Vasotec and Innovase. So let's get started. So it's common knowledge that the heartbeat is indicative of life, and this is why nurses check your pulse when somebody collapses. You're checking to ensure the heart is beating in order to determine if CPR is necessary. But heart function is so crucial because without the heart pumping constantly to deliver oxygen-rich blood to your organs and tissues, they don't really receive the oxygen they need to live and will rapidly begin to die. Aside from delivering oxygen to the body, the pumping of the heart also delivers waste products where they need to go to be expelled from the body. For example, the heart pumps carbon dioxide to the lungs to be exhaled, and it also helps maintain normal body pH by doing so. And this is how homeostasis of pH is kept within the body. So pretty much everybody knows the Valentine's Day version of the heart, little cartoon version, but anatomically the human heart could be further from the cute heart we give our partners. The heart's an incredibly complex organ with 4 separate chambers and 2 atria and 2 ventricles. Atria are the reservoirs for the blood returning to the heart, and ventricles propel the blood where it needs to go. All the atria and ventricles have specialized jobs that are imperative to proper heart function. The right atrium receives oxygen. Hang on, I lost my place. It receives oxygen-deprived blood from the body and pumps it to the right ventricle, which is down here. Then the right ventricle pumps blood down to your lungs. Then blood returns from the lungs to the left atrium, and this is oxygen-rich blood, which then goes to the left ventricle. Left ventricle propels this blood to the rest of the body. The heart chambers are divided by the left and right septum right here. To the left and right by the septum, and there are 4 valves in each heart, each part of the heart. You have the aortic, the mitral, the tricuspid, and the pulmonary valves, and they ensure blood flows the right way through the heart and does not return in the wrong direction. So the heart's productivity is measured by cardiac output, which is the amount of blood the heart pumps in liters per minute. It can be calculated by stroke volume and is multiplied by the patient's heart rate. Cardiac output is flexible with the body's demands and can increase or decrease depending on what's happening with your body, and it's crucial for self-preservation. During exercise, your body needs more air to be sent to its tissues to produce energy and continue exercising. So that's an example. And when the nervous system, or the sympathetic nervous system kicks in during moments of fear, the increased cardiac output gives your tissues oxygen to prepare for self-defense. So cardiac output is controlled by several factors. There are a couple primary hormones involved, the catecholamine and thyroid hormone, both increase cardiac output. And the body's need for oxygenation, when it decreases and the stress is passed, parasympathetic tone is what steps in to lower your cardiac output and bring the body back to its cardiac output baseline. Ready? So cardiac tissue is striated just like skeletal tissue, and it contracts with actin and myosin filaments that are arranged in sarcomeres. This tissue is made up of specialized cells called myocytes that are imperative to heart function. These myocytes only have 1 nucleus, but they possess much more mitochondria than other cells in the body because they have a very intense workload and require lots of energy. These cells are responsible for conducting the electric impulses of the heart and are connected by intercalated discs, which contain gap junctions, and these gap junctions allow action potentials to directly spread from one myocyte cell to the next and essentially beat the heart. So as I mentioned in the last slide, electricity courses through the heart, and it's what causes it to contract and therefore pump your blood. These electric impulses follow the same path in the heart every time, and they're pictured here on my slide. The action always starts in the SA node, which is referred to as the pacemaker of the heart. The sudden depolarization of the SA node is what sets the pace for the heartbeat before proceeding to the AV node, next to the bundle of His, and after that the impulse goes to the right and left bundle branches, and finally they end at the Purkinje fibers. So the SA node contracts the atria of the heart it causes the atria of the heart to contract, and the Purkinje fibers cause the ventricles to contract. When working properly, this electrical system keeps the heart beating steadily in what we call normal sinus rhythm, or it's abbreviated as NSR. Okay, so normal sinus rhythm is the gold standard for the heart. It's usually recognized by 60 to 100 beats per minute for adults, for healthy adults. The beats should be evenly spaced on an EKG, and this indicates that the heart is beating efficiently, the electrical impulses are working as they should. So let's dive in a little bit deeper about the cause of heart contraction. Calcium-induced calcium release is when calcium entering through the plasma membrane connects with ryanodine receptors and causes the release of calcium from the sarcoplasmic reticulum. This action amplifies the calcium signal within the heart and signals pacemaker cells to cause the contraction. This contractility is monitored by our sympathetic nerves, as well as increased afterload and your heart rate. Okay, so the heart contracts with every beat, but how does that ensure blood is pumped where it needs to go instead of flowing back where it came from? The answer to that is the valves of the heart. Like I said previously, there are 4 valves which function to open and close at specific times, and they ensure that the blood flows where it needs to go and flows at the time it needs to move. So the valves are named mitral and tricuspid, and they are called atrioventricular, meaning they sit between the atria and ventricles, and the aortic and pulmonic valves are called semilunar. As can be inferred by the name, these valves between the pulmonary artery and right ventricle, these valves are between the pulmonary artery and the right ventricle and the aorta and the left ventricle. These valves open and close via passive pressure. Opening the valve is when the pressure is higher behind the heart, and closing the valve is when the pressure is higher in front of the heart. The opening and closing of the valves is what a nurse listens to or auscultates and assesses when they're doing their physical assessments of the heart. So as I mentioned previously, the sympathetic and parasympathetic nervous system play a direct role in determining what a patient's heart rate should be at any given moment. Depending on the situation, the patient's heart rate is signaled on a cellular level via specific hormone release. The sympathetic nervous system, or it's also called the SNS, causes the adrenal gland to release epinephrine, and this increases the heart rate and also depolarizes the nodal cells. And the parasympathetic nervous system, or PNS, releases acetylcholine to return the heart rate to normal sinus rhythm, and this also hyperpolarizes the nodal cells. Okay, so we've discussed how the heart works when all aspects of it are functioning, but with such a complex organ, unfortunately there's quite a bit that can go wrong with it. So today I will be discussing heart failure, which is a condition where the patient's heart is failing to pump enough blood out for their body's needs. This lack of circulation causes a variety of telltale symptoms, including shortness of breath, fatigue and weakness due to lack of oxygen in the tissues, edema, which is swelling in the legs, and rapid weight gain, which is caused by fluid backup, nausea and wheezing, and irregular heart rate. And the most obvious sign of heart failure is a persistent cough with pink and frothy sputum, which is indicative of pulmonary edema. Essentially, fluid and scant amounts of blood leak from the capillaries to the lungs and alveoli, and this causes a backup of fluid in the lungs, which is visualized when the patient coughs it up, and this is indicative of congestive heart failure. So heart failure cannot be officially diagnosed and treated by simply visualizing pink sputum, noting as well as noting all the other symptoms. You could see all these symptoms and you can't diagnose heart failure off of that. You have to do specific tests. These symptoms just point the physician in the right direction as to what the patient's condition may be, and the physician will order several diagnostic tests to confirm their theory. So they'll order blood work likely in the form of comprehensive lab analysis in order to check kidney and liver function, red blood cell count, and for iron deficiency. You'll also be looking for an abnormal BNP level, which determines if dyspnea is cardiac or non-cardiac, and it also is indicative of heart enlargement. When reviewing your patient's blood work, note that a BNP of a result greater than 100 pg/ml is what is considered abnormal. The nurse will perform a blood draw as pictured here in my slide with a butterfly needle in order to collect the ordered blood specimen and send it off to the lab where it can be assessed for all the things I mentioned. It's the nurse's responsibility to verify the patient's identity, label the sample properly, and explain to the patient why their blood's being drawn. And be sure to refer to your hospital's policy on blood draws to meet all required criteria, or the blood sample might get rejected. Okay, so another common test to determine if the patient is in heart failure is an echocardiography, which is abbreviated to ECD. An ECD uses high-frequency sound waves to visualize the heart and is ordered to assess systolic and diastolic function, the heart's blood flow, and if the valves are functioning as they should be. The process of an ECD is relatively quick and easy and painless for the patient. A specialized gel is applied to the patient's chest with an ultrasound wand, and the wand is pressed firmly to the chest, and the wand begins sending out sound waves through the patient's heart, which then bounce back to the wand and are translated by the ultrasound machine, and the machine will generate an image like we see here of the heart, and that this can be reviewed. Okay. So the final test for heart failure I'll be discussing today is computed tomography scan, which is abbreviated to CT or CAT, and the magnetic resonance imaging scan, which is also called an MRI. So both scans are used to diagnose congenital cardiac abnormalities, but the MRI is really the gold standard for evaluating right side ventricular function. So starting with the CT, the patient will lie on the table, and the table kind of moves in and out of the CT machine. As you see here, it's kind of shaped like a donut. And the machine will be taking many X-ray images of the chest at this time from many different angles, and this will deliver a very detailed image of the heart that can diagnose anatomical issues. The CT is pretty quick and easy, but the patient will be asked to hold still or maybe hold their breath at certain points to present a clear image of the heart and chest. So the MRI is quite a bit different to the CT. It utilizes a magnetic field to visualize the heart structures. It also shows blood flow to the heart in great detail, which is why the MRI is used to diagnose heart failure. The nurse needs to ensure beyond any shadow of a doubt that nothing magnetic makes it anywhere near the MRI suite, because the magnet is incredibly powerful and can easily cause death or injury if the metal is not removed from the patient. So this includes anything like pacemakers or permanent retainers, jewelry, your stethoscope, things like that can be very dangerous and become projectiles in the MRI room. All metal things have to be removed. So there are many cardiac conditions that can affect the heart, but heart failure is a little bit different than all of the rest of them. As discussed earlier, heart failure is a chronic condition that causes lack of circulation, which can be found through the use of pulse oximetry, which is the little sticker you put on your patient's finger to see how much oxygen is in their tissues. An increase in blood pressure and heart rate are pretty common, and salt and fluid retention are one of the most obvious indicators of heart failure. Fluid retention isn't really seen in other cardiac disorders to this level and can be assessed by weighing the patient frequently and doing a pitting edema test during your physical assessments, which is when you press your fingers into the patient's swollen skin to see how far your finger impressions remain and how long they remain. Myocardial infarction, also known in layman's terms as a heart attack, can look a little bit similar to heart failure and have some of the same symptoms, primarily shortness of breath, fatigue, weakness, and nausea. Cardiac arrest also has some of the same symptoms as heart failure, which includes difficulty breathing, fatigue, nausea, wheezing, irregular heartbeat, and palpitations. So they look kind of similar, but you're really dialing in on the fluid retention and rapid abnormal weight gain. Alrighty. So heart failure progresses in stages, and there are several diagnostic tests which stage the degree of heart failure your patient is at. These include some of the tests I discussed earlier, such as CT, MRI, and echocardiogram. They measure ejection fraction, which should be at least under 50%. Which should be at least 50%, and under 40% is indicative of heart failure. However, there are other tests that can stage the progression of heart failure, including questionnaires on the family history, alcohol and drug questionnaires. You can give the patient a stress test, and a chest x-ray can be given to diagnose heart enlargement, and an EKG can be provided as well. Okay, so the stages of heart failure are as follows. Pre-heart failure, the patient is at high risk of developing heart failure due to CAD, hypertension, genetics, alcohol abuse, diabetes. They don't have it at this point, and lifestyle modifications need to be implemented as soon as possible to reduce the risk for this patient. Okay, so stage B, the left ventricle is not working as well. It is starting to become structurally abnormal. This is often when heart failure first begins to structurally affect the heart, but there may not be symptoms at this stage. Stage C, the condition has progressed to congestive heart failure, so the heart is now enlarged, specifically the left ventricle. The patient is probably at this point coughing up pink frothy sputum, experiencing symptoms like shortness of breath, nausea, fatigue, and weakness. In stage D, patients have heart failure with a reduced ejection fraction. The ECD throws less than 40%, EF, and symptoms are very advanced at this point. Okay, so as presumed from the previous slide, seeking medical help as soon as you suspect you may have heart failure is crucial in preventing the progression of the disease. If you don't seek treatment for your condition, it will affect nearly every aspect of your body and not just your heart. Lack of circulation will eventually lead to kidney failure, directly due to the reduced blood flow to the kidneys. Next, the longer you don't seek help, the more the structure of your heart will change. And change in the heart size causes damage to the heart valves and irregular heartbeat. It will not be as effective with its cardiac output. And you can also expect liver damage and scarring due to the excessive fluid buildup in the body, causing too much pressure on the liver. And finally, worst of all, the patient may suffer cardiac death due to the irregular heart rhythm found in heart failure cases. Okay. So heart failure obviously is bad for the patient. There are 4 subclassifications of heart failure that have different negative effects on the body, which include right-sided, left-sided, diastolic, and systolic. Starting with right-sided heart failure, it's usually a direct consequence of untreated left-sided heart failure. Blood leaks back into the lungs and accumulates there since the left side of the heart isn't pumping blood properly as it should, causing it to remain in the lungs. This causes the right side of the heart to need to work much harder in order to compensate, and is eventually what leads to right-sided heart failure. And this causes blood to essentially back up in the veins, and the patient's lower extremities will swell. So left-sided heart failure is far more common than right-sided and occurs when the left ventricle doesn't pump efficiently, leading to blood backing up and leaking into the lungs. This is where the pink frothy sputum and pulmonary edema comes into play, as well as the patient's shortness of breath. So to break it down, there's two different subclassifications of left-sided heart failure, diastolic and systolic. In diastolic heart failure, the heart is much stiffer than it should be, which means it can't expand and fill with blood as it should, which is a cause of decreased cardiac output. And in systolic heart failure, the heart loses its ability to contract because the heart's too weak or has become enlarged. So this means that oxygen-rich blood can't be pumped out as easily as it should. So there's not a lot of absolutes in healthcare, but every disease has both modifiable and non-modifiable risk factors, and heart failure is of no exception. There are many things you can do to minimize your risk in heart failure, including controlling your hypertension by taking medication, not smoking or quitting smoking, controlling your cholesterol with medication and a healthy diet, maintaining a healthy body weight through exercise and good food choices. And there are also, unfortunately, non-modifiable risk factors that just can't be changed and make heart failure more likely. So that would be advanced age, 65 plus. Being male makes it more likely to develop heart failure earlier in life. Genetics and a family history play a large role. And your race can put you at higher risk. African American people are at greater risk for heart failure. So all of these risks should be discussed with the patient's primary care practitioner if symptoms begin to arise. Okay, so heart failure damages more tissues in your heart and makes detection pretty important for your overall health. As previously discussed, heart failure essentially remodels the heart and causes it to grow and stiffen as it tries to keep up with your blood pressure, your high blood pressure. This harms the valves and causes regurgitation and leads to myocyte necrosis, which is essentially cell death in your heart. You may also experience lung stiffness and dyspnea, which is difficulty breathing. Kidneys may become congested with blood, and they'll become diseased due to heart failure and may fail, and the excessive pressure on the hepatic portal vein scars the liver and reduces its function. And here's an image of all the risk factors for heart failure and what causes the tissues and cells to begin to die. So this is how damage leads to symptoms from a physiological perspective. Shortness of breath is caused by fluid accumulation and pulmonary edema in the lungs. This is also what makes the patient begin to wheeze and cough. Their lungs aren't working as well because they're leaking full of fluid. The patient's chronic fatigue is due to the fact that oxygen-rich blood is not reaching all of their tissues and muscles as it should be. This is somewhat similar to an anemic patient. They're not getting enough air to their entire body, so the body has less energy and needs to work harder to keep functioning. Peripheral edema, which is swelling of your extremities, specifically your legs and feet, is explained by inefficient heart pumping, which causes this fluid to pool instead of keep moving. This leads to the characteristic swelling of the feet and legs and rapid weight gain. So the cough with pink sputum is another massive indicator of heart failure, and it's caused by, like mentioned previously, the fluid and blood leaking into the lungs through alveoli because the heart's not pumping well enough. The fluid is sitting there and it is leaking where it should not be. So the most influential risk factor of heart failure is hypertension, prolonged and uncontrolled. Um, it increases the heart's workload and leads to the heart enlargement and remodeling, and this causes decreased cardiac output and heart failure. Peripheral vascular resistance is what reduces organ perfusion and leads directly to hypertension. This makes it obvious that the most effective way to stop the progression of heart failure is keeping hypertension under control. So here's an image of what is considered normal, elevated and high blood pressure for an adult patient. So the primary drug used to treat congestive heart failure is called enalapril, and it's the drug of choice because it acts to lower blood pressure. Enalapril is an ACE inhibitor. The full name of an ACE inhibitor is angiotensin converting enzyme inhibitor, and these ACE inhibitors work by acting upon angiotensin converting enzyme, connecting to the receptors there, and this prevents these enzymes from producing angiotensin 2, which then acts to cause vasoconstriction through the alpha type 1 receptor. So preventing angiotensin 2, this means that the blood vessels cannot constrict as much as they would, and the dilation of the blood vessels leads to lower blood pressure, which therefore resolves stress and pressure on the heart. So enalapril is approved for use in congestive heart failure patients, but it is contraindicated for people who are pregnant in their second or third trimester, and this is due to the potential effect that it may have on the fetus and or baby. This increases the risk of it increases the risk of fetal renal damage, so that's why it's contraindicated in pregnant women. Enalapril is also contraindicated in breastfeeding mothers, as the medication can be inadvertently given to the baby through breast milk, which can cause neonatal hypotension in that baby. So let's dive a little further into enalapril's mechanism of action. As mentioned before, ACE inhibitors work by binding to angiotensin converting enzymes to prevent angiotensin 1 from binding to those same receptors and converting into angiotensin 2, which is the vasoconstrictor. So angiotensin 2 is therefore prevented from matching with receptors called AT1 and AT2, which is what actually causes the vasoconstriction of arterioles, aldosterone release, and increased thirst and antidiuretic hormone. All of those things I just mentioned combine and translate to a clinical manifestation of lower blood pressure. Enalapril relieves heart failure symptoms simply by managing your hypertension. By dilating the blood vessels, it'll resolve many of the common symptoms that you see, like headaches, heart palpitations, difficulty breathing, since there's less stress within your arteries. Specifically in congestive heart failure, a lower blood pressure also decreases the left ventricular afterload, which then decreases cardiac output and decreases heart filling pressures in the left and right heart chambers. So by doing this, it acts to resolve pulmonary and systemic congestion. So when compared to other hypertensive meds for heart failure, enalapril is usually the drug of choice. This is partially attributed to how it's longer acting than captopril, but shorter acting than other common ACE inhibitors. I looked at a study where it compared the medication captopril to enalapril in a double-blind study, and it was discovered that while they're similarly effective, enalapril is actually more potent, longer-lasting, and safer than captopril, which makes it the drug of choice for treating heart failure. Congestive heart failure is caused by many factors, and the primary cause is chronic uncontrolled hypertension. Chronic hypertension causes an increase in the workload of the heart and distorts the heart shape over time. This distortion causes ineffective stroke volume and decreased overall blood circulation. To prevent heart failure from developing or progressing, ACE inhibitors such as enalapril are prescribed to lower blood pressure and reduce the strain on the heart. Therefore, preventing irreversible remodeling of your heart, increasing the cardiac output, and reducing congestion of blood in your pulmonary and systemic circuits. That is it. Thank you very much.